What treatment would you recommend for under eye hollows? I'd like some help with what I can do with my under eye area. I saw a plastic surgeon the other day, and he said my under eye hollows are due to naturally hollow cheekbones, so my under eye area isn't supported. Also, thin under eye skin and prominent brow. He also said in his opinion I would need a number of surgeries to correct this, including cheek implants, fat transfer, brow and nose shaved too. Couldn't I just have a lower bleph to correct it to bring up the lower area and so there isn't so much thin skin?
Thank you for your question. You submitted a photo and you described in pretty nice detail your recent consultation with a plastic surgeon about the puffiness and the appearance of your under eye area. And interestingly, this plastic surgeon made an assessment about the relative prominence of your cheeks, and the recommendations that came from that included cheek implants, nasal surgery, etc. I mean, that's quite a lot. And your question, of course, is, can you just have a lower eyelid blepharoplasty? Well, assuming you already understand, but I'm just going to give you a brief overview of what the plastic surgeon was describing. When we look at a person's lower eyelids, we assess why are they puffy. Most commonly, they're puffy because of something called lower eyelid fat prolapse. Lower eyelid fat prolapse means that the fat that's normally around the eyes pushes forward, creates a bulged appearance, and at the same time, a lot of people have skin discoloration. So, when we are addressing lower eyelid fat prolapse and skin discoloration, we do a combination of approaches. One is to do a procedure called a transconjunctival blepharoplasty, and that's to reduce the fat pockets from the inside of the eyelid, and by doing that we're able to reduce, reposition, and do whatever procedures are necessary in order to restore the contour. When it comes to the discolorations of the skin, just briefly, we routinely try to help people with a material called platelet-rich plasma. Platelet-rich plasma is derived from your own blood, and essentially it's a concentration of the growth factors and the healing properties that are necessary for wound healing. And we have found this helps people, the skin quality improves significantly. Now, when we do this type of procedure, what we're doing is we're taking away the negative that dominates your face, the negative aspect which draws all of the attention. You know, in the field of cosmetic surgery, we try to look at things both with a close-up view as well as a holistic view. And when I look at a patient, I just think, what's the dominant feature that is drawing the attention, and is that dominant feature taking away from the face? Well, when someone has bags under their eyes and they always look tired, it just affects everything on their whole face. Now, in terms of what the doctor was mentioning about the cheeks, there's something called negative vector, and it means that the cheekbone is relatively less projected compared to the eyeball or the front of the cornea. Now, that is a setup in certain patients for issues related to cosmetic eyelid surgery, such as lower eyelid retraction. And we see many patients from all over the world who unfortunately had surgeries done from an external approach, and then during that external approach, or what's called a transcutaneous blepharoplasty, skin was removed. And at the same time, nothing was done to support and control the position of the lower eyelid. What eventually happens during the healing process is the lower eyelid pulls down and it creates retraction. In some cases, it actually everts and it causes ectropion, or the eyelid being exposed from the inside. So that being said, your doctor made a valid assessment as to your anatomy. In our practice, we're of course very sensitive to this, and by doing the approach we do and doing other things that are specific to my experience and expertise, we manage to avoid these types of issues 99% of the time. And so, that being said, I would agree with you that you may want to just start by just dealing with the issue on your face that is dominant and is the most negative, which is the puffiness under your eyes. If after that procedure is completed, you still feel that you want more cheek projection or you want other things dealing with your nose, then you can pursue those other things. I think a lot of plastic surgeons are biased because when they look at a patient, they want to try to fix everything. And two, because they do everything under general anesthesia, they want to try to do as much as they can for that patient during that one general anesthesia session. In our practice, we don't do general anesthesia. We do everything from eyelids, facelifts, breast augmentations, liposuctions, tummy tucks. We do everything under local anesthesia with sedation. And so we're able to give our patients a lot more flexibility from that perspective. And so, that being said, just putting aside the anesthesia issues, I think that trusting your own instincts about addressing the lower eyelids alone will probably make a significant enough difference for you. It is really dramatic how the whole face can be enhanced dramatically by reducing the puffy bags under the eyes. So at this point, meet with other cosmetic surgeons and get some other opinions, and then find a doctor that you resonate with and get a realistic understanding of your outcome. And once you do that, make the decision and move forward. So I wish you the best of luck. I hope that was helpful, and thank you for your question.